person's bloodstream. Note, this could also be deliberate in the case of harm or hard drugs. However, victims are usually not abreast of the full chemical composition of the substance entering their body. Now, we are saying for ingestion of chemicals, it could also be deliberate. It's not always an error or a mistake. Some persons who consume certain hard drugs may not be aware of the chemical constituent of those hard drugs, and after taking them, they are then causing or they then cause harm or damage to the person's system. So chemical hazards could enter into the body, or a person may be exposed to chemical hazards through injection. So general knowledge about chemical hazards that you should know. The symptoms of exposure depend on the type of exposure and can be abdominal pain. Abdominal pain will usually show up if the mode of exposure will be ingestion through the mouth and GIT, breathing difficulty if it was via inhalation, dizziness, headache, pain where contact is made with the skin. For example, the part of the skin that the hazard or the chemical touches can become painful and inflamed, weakness, and even unconsciousness, depending on the effect of the chemical on the body system. So how can we control chemical hazards? The first is that all chemicals must be labeled, whether it is just 10 ml of a chemical substance that is in a syringe, you must label it. Remember, many of these chemicals are colorless and some could be odorless. Hence, people can mistake them for water. So it is essential that you label all chemicals. All is the key word. Do not eat or drink while handling chemicals so as to prevent ingestion, that is through the mouth. Workers must follow standard operating procedures, SOPs, when handling chemicals. Every chemical comes with a manual or standard operating procedure that tells you how the chemicals should be handled, the risk or the hazards associated with the hazard, and what you can do to control them. So always ask for the SOP of any chemical before you handle them. Use personal protective equipment such as gloves, coveralls, nose masks, respirators, etc. that can help keep you safe from exposure to these chemicals. Workers must work under supervision. It's essential that workers work under supervision with